Welcome to my podcast. Today I'm going to talk about another station. So basically, after you introduce yourself and ask the patient name and date of birth, you'll ask the patient, how can I help you today? So the patient might say that, doctor, I'm having a pain in my chest. So you'll ask, tell me more about it. So the patient might say anything. Just you need to explore around what the patient says to you. Say, for instance, if the patient say, the pain comes and goes. When I do some exertion, I feel the pain. So you need to ask, can you tell me about the characteristic of the pain? Can you point out with your finger where about the pain exactly? Is it sudden? Is it gradual? Any history of associated trauma or injury? You will ask the patient how intense the pain. Are you able to do the physical activity you are doing in the normal days, or it's just stop you from doing everything? You will ask the patient to ask what's the characteristic of the pain. So if, for instance, is it like pulling? Is it like dissecting pain? Is it like do you feel like cramps in the area? Does the pain refer anywhere? Does it go anywhere? Does it go to the jaw, for instance, or the left shoulder? So, and then we'll ask if anything that he notices or he can do that will relieve the pain, for instance. And what time of the day it starts? Is there any specific time, for instance? Is there any specific position or posture he's doing that triggered the pain? So you need just to think about the whole differential of chest pain causes. And also you will ask, when you say about the intensity, you will say in a scale from 1 to 10, where, 10 is the unbearable pain and 1 is the least, where would you rate your pain now? And you will ask if he had done anything or took any medication by himself or anything that he tried to improve the pain. So basically, in differential, we know that if the patient say, for instance, I'm having like a feeling of heartburn or indigestion, or bringing up certain food with bitter taste, so in this condition, you will direct your differential mostly about anything that could cause heartburn. If the patient says that I feel the pain while I'm lying in bed and I need to move from certain position to the other, so it could be muscular, and there is a specific name for that kind of pain. If the patient says, for instance, you will ask if there is any triggering factors. He say might be in a situation where he's very stressful or feeling panic attacks. So in that condition, it could be simple measures. So it could be panic and chest pain. You will ask the patient if you had any preceding upper respiratory tract infection in the last few days or any viral infection. So the patient might say yes. So you're going to ask if there is any fever at all, if there is any phlegm, if the patient is producing a phlegm, if there is an associated cough. You will ask also if there is any burning sensation. So in certain situation, it could be the patient might say, I'm having only in one side, which is burning and unbearable. I can't relate my clothes on. So you might think about shingle. So you will ask if there is any skin rash or there is any blisters at all. You will ask the patient if the patient says, I'm having sudden sharp pain and it's stabbing and characteristic, and with the deep breath, I'm feeling that pain, you will ask if there is any improvement with getting upright, moving forward. So it could also point out to pericarditis. So you'll ask if there is any preceding viral or upper respiratory tract infection. If the patient says this pain comes when I go uphill or when I do a mild exertion, but when I'm sitting, I don't have any pain. So we'll ask, it could be pointing to angina. So you will ask if there is any, if this pain relieved with, for instance, stopping the activity. So that in that condition, it could be stable angina. If the patient say no, it comes anytime, even while I'm sitting. So it could be unstable. So all of that you need to ask and ensure that there isn't any life-threatening or serious condition that been missed. Most of the cases, it's usually basically not serious, but you need to rule out any red flags at all. And after you ask it all of that, you will ask if there is any associated shortness of breath, for instance. And if it's sharp, for instance, or sudden, and if there is any history of travel, or if history taking any pills like or contraceptive pills, so in that condition could point, pulmonary embolism. Or if the patient is a young one, tall, has history of sudden sharp pain with shortness of breath, this could point out pneumothoracic. If the patient says that having shortness of breath after I ingested something, so this point out to anaphylaxis. So you need to explore more according to the patient information he will provide you. So the history will guide you to which differential you need to go. If the patient says I'm having shortness of breath all of a sudden, especially in elderly, they might be eating or have issue with with the deglutition. So it could be foreign body. So in that condition, usually it's in elderly, or maybe sometimes adult if he's talking and eating, and so he got choked all of a sudden. So this could point out to the foreign body, which is basically food. If the patient says, for instance, I'm having this in early morning or with certain activity, so you need to think about asthma and ask if there's any history before. If the patient is, for instance, look to you debilitating, massive loss of weight, or he look like he's not very well, and you need to explore more. So you need to ask about sexual history. You need to ask about drug intake, like IV drugs. If there is history infection, like HIV, or other activities should contribute to that. So in that condition, you will explore if there is an associated cough, for instance. So this could point out to pneumocystis carinii. And if there's any fever, basically with shortness of breath and chest pain, it's always you need to think about pneumonia. So you will direct your differential according to the patient, what he says. So after basically you explored all of the differentiation that I just mentioned, you will just need to ensure that the patient is aware if there is anything sinister that he needs to put in consideration. So if the patient, say for instance, when you are asking if the patient, you will tell him if the pain started to be continuous, if the pain started to spread to the jaw, to the back, or if the patient says I'm having pain which is like dissecting, like tearing pain, which goes to the back. So this will point out to the dissecting aortic aneurysm. And usually there is a history in the family. And you will ask if there is anything that doesn't seem right, or if the pain is continuous and lasting for long. Always call the 999 or go to the A&E immediately. And after that, of course, you will go and ask about any previous medical history that is relevant to the history, and ask if the patient is a smoker, for instance, what sort of a diet he's taking. If the patient is, what's his body mass index, so if the patient is overweight or obese, all of that could be one of the things which could contribute in one way or another. And after all of that, you just, of course, when you want to send the patient, after, of course, you examine the patient after his permission or her permission, of course, with a chaperone, if there is a need for that, or you need just to mention it. So you will examine the patient observation just to make sure that there is nothing missed in the vital signs. And then according to the presenting symptoms, as we said, there's chest pain or associated with shortness of breath. So you will ask the patient, I would like to examine your chest. Can can you expose the area, if that's okay with you. And I'm going to have a chaperone for your convenience. Sometimes the patient says, I want a female one or a male one, according to the gender, of course. And then you will examine if there is anything. Basically, for the examination, that's another issue that I will try to mention in another podcast. However, here, you just need to, of course, listen to the heart, listen to the airway, look for the movement of the chest, and, of course, do percussion and auscultation if there is any finding. And then you will agree with the patient a management plan. So according to the cause, you will just explore and manage, and always send the patient with the safety netting, and because it's very important not to miss any of the important sinister causes. So by that, I hope that I covered chest pain with the shortness of breath in one go. Thank you.